The bone block cerclage technique for glenoid bone loss is an arthroscopic surgical procedure that preserves the integrity of the subscapularis and provides a metal-free fixation of a bone graft. After soft tissue release and bone preparation, with direct vision from an anterolateral portal, the glenoid defect is measured using an arthroscopic measuring probe through an anteroinferior portal. The middle of the defect is calculated to aid in correct placement of the drill guide. Insert the TransGlenoid guide hook through a posterior portal and place the anatomic hook flush to the glenoid surface, as close as possible to the center of the defect. The hook of the guide is curved to sit flush to the glenoid anatomy and features a 10-degree safety angle incorporated in the shaft. The V laser mark projects to show the expected exit points of the drills. Select the desired offset, 5 or 7 mm, and introduce the drill sleeve until firm contact is felt against the posterior scapula. Take note of the intraosseous distance depicted by the laser marks on the drill sleeve. Using the short cannulated drill first, drill a 3 mm bone tunnel across the glenoid with direct visualization of the defect and drill exit points. The drill tip should exit anteriorly, as the corresponding laser mark on the drill lines up with the drill sleeve. Use the long cannulated drill in the same manner for the second bone tunnel. Remove the drill sleeve and use the slot in the handle to remove the guide hook, leaving the drills in place. Drill 2 tunnels through the bone block, 1 cm apart and corresponding to the medial glenoid offset of the previously drilled tunnels through the glenoid. Remove the pins from the cannulated drill. Pass a suture lasso wire through the cannulation of the drill from posterior to anterior, leaving the loop of the wire posteriorly. Retrieve the wire out of the joint through the rotator interval and then remove the drill. Pass another wire through the cannulation of the second drill and retrieve through the rotator interval, leaving the loop anteriorly. Replace the wires with FiberLink and TigerLink sutures, making sure to leave the loops as done previously. Use the loop of the FiberLink suture posteriorly. Pass both single limbs of the FiberTape and TigerTape cerclage sutures through the same glenoid tunnel, through the rotator interval, and out the anterior portal. Use the megaloader to pass both cerclage sutures through the cancellous side of the bone block and then back through the other drill hole. Use the remaining TigerLink suture loop to transport the cerclage sutures through the rotator interval and the other glenoid bone tunnel. Introduce the graft and maintain orientation while pulling on the sutures posteriorly. Pull on each limb to individually remove the slack. Introduce the single limb of the FiberTape cerclage suture into the knot of the TigerTape cerclage suture using the orange loader. Remove the loader and make sure to slide the FiberTape cerclage suture until the tape portion and slightly tighten the knot. Repeat the process for the TigerTape cerclage suture and FiberTape cerclage knot. Grasp and pull the individual sutures a few centimeters at a time, alternating between the suture pairs to reduce the knots down to the bone. To make sure the knots are fully reduced to the bone, load the FiberTape cerclage suture into the tensioner and lightly tension until resistance is felt. Repeat this step with the TigerTape cerclage suture. Cut the FiberTape cerclage suture to separate the limbs. Throw a half hitch and reduce the knot to the bone. Insert the hitching suture limb into the tensioner and tension to around 30 while having direct visualization of the anterior portion of the bone graft in the cerclage suture bridge. Apply additional alternating half-hitch knots and cut the sutures. Repeat the same steps for the TigerTape cerclage suture. Reattach the capsulolabral complex to the anterior glenoid rim with knotless 1.8 FiberTac anchors. To avoid damaging the construct, use flexible, non-fluted drills when placed between the bone tunnels.